The UK government has announced the date for its major Glasgow summit on tackling the terrible scourge of drug misuse, February 27. The summit will bring together drug recovery experts, health professionals, government ministers and senior police officers from across Scotland, England, Wales, and Northern Ireland. They will discuss how to work together to best prevent deaths related to drug misuse, which reached 4,265 across the UK in 2018, more than a quarter occurred in Scotland. The event will also boost collaboration between the UK government and the Scottish, Welsh and Northern Ireland administrations on this UK-wide issue, with Professor Dame Carol Black, the independent reviewer of drugs, presenting her findings to the devolved administrations at the summit. Kit Malthouse, the UK government's policing minister, who will chair the event, said, "People are dying from drugs every day across the UK, and this summit will bring us together to tackle the issue of drug misuse. We must have firm enforcement action and do all we can on prevention, recovery and treatment too. I look forward to meeting key individuals from across the UK and listening to their views on addressing this challenge." Alistair Jack, the Scottish Secretary, added, "The high numbers of lives lost to drugs in Scotland is a tragedy, a huge cause for concern. I am pleased that the UK government is to bring experts together from all parts of the country to share experience about tackling this terrible scourge." Among those also expected at the Glasgow summit will be Joe Churchill, the junior UK health minister, health officials from the 4 nations and regions of the country, senior police officers, Edward Day, the drug recovery champion, Owen Bowden-Jones, the chair of the Advisory Council on the Misuse of Drugs, and representatives from the National Crime Agency. While the legal framework relating to the misuse of drugs is reserved for the UK government, the Scottish and Welsh governments and the Northern Ireland executive have their own approach to preventing the harms of drug misuse in areas where responsibility is devolved, including healthcare, criminal justice, housing, and education. For more on this story, visit the news article link.